Hey everybody, welcome back. Thank you so much for tuning in again. Today we are talking about how to prepare for your first gynecologist appointment. Okay, so in this YouTube we're going to cover how to prepare for your first GYN appointment. And then in my next one we're going to talk about what actually happens at your first appointment. Get your pen and paper ready because here we go. All right, congrats. You've scheduled your first appointment with your gynecologist. I know it might seem really scary and really nerve-wracking, but I promise we're pretty normal people and it's not going to be that bad. Okay. First thing to do when getting ready for the gynecologist, I want you to know your history and your medications because we are going to ask about that, just like at any other doctor's visit. What do I mean by that? I mean knowing anything you've ever been diagnosed with before, like asthma, high blood pressure, diabetes, any thyroid issues, anything that a doctor or a healthcare provider has told you you have, we'd like to know about it. We also want to know about your surgeries if you've had any surgeries before. We want to know about family history. Is there anybody in your family who has a history of cancer, heart attacks, strokes, clotting disorders, heavy periods, that kind of thing? And if you don't know your family members or your family history in great detail, I don't want you to think you have to go start calling everybody, but if you do know it, it's super helpful for us. If not, that's okay. We want to know what medications you're taking, and we want to know the names and the dose. I mean, we're really good, but it's really hard if somebody comes to us and says, well, yeah, I take that white pill for my thyroid. It's like the oval-shaped one. I mean, again, we're good, but we're not that good. So if you can just write down your medications, the dose and how frequently you take it, that'd be super awesome. We also want to know about any supplements or herbal supplements or things over the counter that you might be taking. That counts as a medication, and we want to know about it because it can interact with some things that we might prescribe or want to do. Okay, you're coming to the period doctor, right? So we want to know about your periods. Here's specifically what we will ask you. We want to know how old you were when you got your first period. And if you can't remember exactly, that's okay. If it's 12 or 13, 12 or 13 works for us. We want to know how frequent your periods are. So every 28 days, every 32 days, every 3 months, we want to know about it. We want to know when you do have your period, how many days do you bleed for? And how are they? Are they really heavy, painful, crampy, terrible, ugh? Or are they not too bad? Or it's only really light spotting, you're not even sure if it's a period. We want to know. It's also really helpful for us to know if you've been pregnant before. And if you are bringing somebody to the appointment and you don't feel comfortable talking about that, that's okay. I'm going to highlight confidentiality in another YouTube video. Now the question that you've all been waiting for. What do you need to do to prepare your hair down there to go see the gynecologist? And here's the answer. You need to do nothing because we do not care. Now, if you want to shave or wax or whatever, that's totally fine if that's your personal preference. But we don't care if you've never shaved or you come in completely bare. I don't want you to feel that you need to sprinkle glitter and pixie dust down there for us. And in fact, we prefer that you not do that. We prefer less is more. Pubic hair truly has a purpose, and if you followed my TikToks and my Instagram, you know that. And for sure, we'll cover it here too. But please don't feel that you need to do anything special with your hair. You do not need to use any special soaps, washes, douches. In fact, that's terrible for your vulva and for your vagina. So less is more. We don't care. We see hundreds, if not thousands of vulvas in our career. A little hair doesn't scare us. Also, if you're on your period, that's totally fine too. So please don't feel that you need to reschedule if you're on your period. Okay, so it's your first gynecologist visit and you're like, I'm so nervous, I'm so scared, what do I do? Well, another way to prepare is to bring a friend or a family member, bringing somebody with you so that way you can feel a little more confident and a little more supported. Keep in mind, we talk about a lot of stuff, and ideally your doctor or midwife or healthcare provider should have that person step out so you can talk confidentially one-on-one with us. But just in case they don't, do be mindful of the person you're bringing and be okay with saying whatever it is in front of them. For example, when we talked about medical history, it's important for us to know if you've had a history of gonorrhea or chlamydia or herpes or anything like that. Are you comfortable talking about that with the person that you're bringing with you? If not, you might not want to bring them. Maybe one of the most important things that you can do when you're preparing to see your GYN for the first time is to write down your questions, either on a piece of paper or somewhere in your phone, because sometimes when you do something for the first time, you get so nervous that you have these questions and these things you want to talk about, and then you go completely blank when we say, so what questions do you have for us today? And it's not until you're out in the car driving home that you're like, I wanted to ask about whatever. So writing them down, bringing a list, and bringing that up sooner in the appointment rather than later can ensure that we get to all those questions. Now, sometimes we just don't have time to cover everything, and we may have you come back, but do know that we do want to answer all of your questions and get all your concerns addressed before you leave the office. It can be really helpful when you're going to the gynecologist for the first time to read up on what to expect, what might happen, what we might do, what's an exam like, and guess what? I've got you covered. That's my next YouTube coming up. So stay tuned on that one. Bottom line, visiting with a GYN or a women's healthcare provider should not be scary. You should feel empowered and proud of yourself for taking care of your health. And the person that you see should be somebody who feels like a friend or a partner, somebody that you can say anything to. Because trust me, we have seen and heard it all. So when you're getting ready to see one of us, do not be afraid to ask all the questions that you've got. Do not feel embarrassed. Seriously, that's our job. I hope this helped you prepare for your first GYN visit. If you have any other questions or comments, be sure to drop them in the comment section. Please be sure to like and subscribe so that you'll get notified for when my next YouTube is up and my next one that's coming up. What actually happens at the gynecologist's office? Thanks so much for watching. See you later.